Please be sure to have a friend or family member accompany you to the center for this procedure, as you will be medicated during the procedure and will be unable to drive for the rest of the day. Please plan on a possible 3 to 4 hour stay at the center. Your driver will be required to stay the entire time as well. We also advise that all valuables be left at home. EGD, or esophagogastroduodenoscope procedure, is done by inserting a flexible scope into the mouth, and it will travel down the same path as your food into your stomach. During this procedure, the esophagus, stomach, first part of the small intestine, called the duodenum, can be examined. Biopsies can be taken and polyps removed. Why this test is performed. Causes of upper gastrointestinal bleeding, swallowing difficulties, presence of ulcerations or inflammation, cause of abdominal pain, conditions of the stomach and duodenum after an operation, presence of tumors or abnormalities in the upper GI tract, or the narrowing or tumors of the esophagus. Prior to the test, an IV will be started. IV will be started in order for sedation to be given during the procedure. Once in the procedure room, you will lie on your left side and a bite block will be inserted into your mouth. The bite block holds your mouth open and protects your teeth. Nurse anesthetist or anesthesiologist will administer IV sedation and monitor you throughout the procedure. Once you are sedated, the scope will be passed through the bite block into your mouth, down your esophagus and into the stomach and the first part of your small intestine. The exam usually takes 5 to 10 minutes. The physician will take biopsies if needed during the procedure. Biopsies may be taken for many different reasons and does not necessarily mean cancer. You should not feel any discomfort during the procedure. After the procedure, you will be transported to the recovery area where your vital signs will be monitored until you are fully awake. Air will be introduced into your stomach during the procedure, so you may feel bloated during and or after the procedure, or you may have belching. You may experience a sore throat after the procedure for the next 24 to 48 hours. However, it is rare. 5 days before the procedure, do not take any anticoagulants, blood thinners such as Coumadin, warfarin, aspirin, Ecotin, ibuprofen, Plavix, arthritis medication, or iron pills. Do not take these medications for 5 days before or 5 days after the procedure. You may take Tylenol for any minor pain. Please review the following instructions. Do not eat or drink anything from 12 a.m. midnight the evening before your procedure. We recommend holding all morning medications until after the procedure. Please note we require that cancellations be done at least 24 hours in advance, or you will be billed an encounter fee of $40. If you have any questions, please call 883-0029. If you have any questions, comments, or concerns, need to change or cancel your appointment, please feel free to call us at 883-0029, extension 236.